Hello, my name is Darian Rogers, and I'm here to present about the Women's Protection Act of 2019. So, as most of you know, abortions are commonly perceived in a negative light, especially in America. Opinions surrounding abortions are commonly formed based on religious views, personal ideals, morals, values, or one's own experiences. Due to society's perceptions of abortions, some providers and healthcare organizations are hesitant to perform the procedure, causing a lack of availability to women. The Women's Health Protection Act of 2019, Bill number 1645, was introduced at the 116th Senate Conference by Senator Richard Blumenthal, May 23rd, 2019. The Women's Health Protection Act is currently in its first stage of introduction. The bill needs to pass through the Senate, the House of Representatives, and then finally reach the President for approval. So even though the bill has been introduced to the Senate, it has not been denied, but it also has not been passed and hasn't progressed into the next stage yet, and we are in August. So, in due time, hopefully, we will hear that the House of Representatives has reviewed the bill and agrees to push it forward to the next stage. So, I personally found this bill to be extremely important. There are many bills that were introduced that I feel are just as important, but this is the one that I wanted to discuss personally. The bill addresses the problem of abortion by protecting a woman's ability to determine whether and when to bear children or end pregnancy, and it also protects a healthcare provider's ability to provide reproductive healthcare services. Healthcare providers have been singled out and hindered by restrictions when trying to perform the procedure. These barriers have created situations where the ability to perform the procedure has become extremely difficult. The issue with putting up barriers when it comes to allowing women to go through an abortion simply leads to unsafe circumstances. Some women are extremely desperate and have been put in situations that the only way out of it is an abortion. But if you have clinics unwilling, providers unwilling, or even just policies unwilling in certain states, counties, cities, etc., these women are forced to put themselves in unsafe situations and find another way to rid themselves of the child. With that being said, that doesn't mean we need to force abortion on people or the idea of it, but it should be available for a variety of reasons. And one of those reasons is making sure women remain safe and get the care that they desire while also need. Abortion has been recognized by the government since 1973. It is commonly only performed in the capacity to preserve the life of a mother or their child. This is saying that when abortion was finally being done and performed on women, it was never because the woman just wanted to. She had a one night stand. She was abused. She just simply doesn't want to have the child anymore. It was more so in the form of if this woman were to have this child, they will lose their life. Their child will not survive. Their child will be sickly, unhealthy. Things of that nature were the original reasons abortions were used. Over the years, people have begun to recognize abortion in a different light, but access to it is still fairly limited. The act is ultimately intended to protect women and provide them the ability to make their own decisions. Grand scheme of things, yes, abortions are there to rid women of their child. But if you really think about it, allowing women to choose to have an abortion simply gives them back their power. And that is extremely important in this day and age. Women have been seeking abortions for different reasons, with each country having their own ideas and opinions on the procedure. It is important to recognize that even though the countries are very different, there's a lot of overlap concerning why women decide to follow through with an abortion. For this particular bill, there are social, ethical, and political impacts. Socially, abortion can be on a very large spectrum. There are people who support it, there are people who are completely against it. Trying to achieve social approval when it comes to abortion has proven to be very difficult and based on one's personal beliefs and ideals on the procedure. Abortions were not always seen as ethical, and even with the recent improvements, it is still seen as an unethical procedure. The idea of ultimately killing a child is seen as unethical. But depending on who you talk to and who you have a conversation with, after a certain time, depending on how early it is, some believe within 8 weeks, then you have a viable baby, it is considered murder. Some people believe after conception, you have a baby and it's considered murder. It all depends on where you are, who you're talking to, what state you're in, and the year that we're in, to be quite honest. The political impact is seen in the simple passing of abortion laws throughout the government, whether it advocates for the rights of women or against the rights of women. There have been abortion laws being passed over the last few months to a year, left and right in different states. Unfortunately, many of these states have been passing laws against women's right to choose an abortion, no matter the circumstances. If they were abused, if they were in an uncomfortable situation, if they were raped, or anything of that nature, these states do not believe women have a right to get an abortion. I personally found that to be quite ridiculous, if I do say so myself. I understand putting barriers up to prevent the overuse of abortion, but in many instances, an abortion is necessary for the mental and emotional well being of that woman or her family or anything of that nature. So, seeing these laws being passed over the last few months in these different states was very heartbreaking. There are various entities that are against the use of an abortion for any reason, even when it comes to preserving the lives of the mother or the child. In reviewing the Women's Protection Act of 2019, there were many Republicans who did not support Senator Blumenthal's bill introduction. There were also people who supported the act. 43 Democrats supported the act. Some of these well-known Democrats include Cory Booker, Mark Warner, Kamala Harris, and Bernie Sanders. These are just the few that stuck out to me based on the current political debates going on. There's also the Naral Group, who spoke out about the Women's Protection Act and spoke highly of it and how it was important to establish a woman's right to do what they felt necessary for their body. There was also Senator Mace's view, who didn't necessarily support it, but they weren't completely against it. In her view, She had certain opinions on when an abortion should be performed and when it was deemed necessary, but all in all, she was not completely against it, which I thought was important to identify. So, a nurse's perception on abortion varies on a variety of reasons, the same as it would in society. Some nurses are in full support of the procedure, while others are completely against it. The determining factor of why nurses' opinions vary are due to a plethora of things. It is a complex challenge for healthcare professionals in the healthcare organizations. There's a belief that nurses' opinions on abortion are not only affected by religious reviews and their upbringing, but also in how it's introduced during their training and how the idea is presented to them. And I would have to agree. An individual's initial impression of something can ultimately change how they perceive an idea. Recommendations for the bill: 49% of all pregnancies in the United States are unintended, and 43% of unintended pregnancies end in abortion. There are many broad themes surrounding why women seek abortions, including financial reasons, partner related reasons, and a combination of several other themes. Abortions can produce both positive and negative results. It is important to ensure that when the policy is implemented, there are barriers to limit the abuse of the policy. Having the Women's Protection Act of 2019 implemented properly can truly change the success and the difference that it makes. I appreciate you all listening to my presentation today. Abortion has been a very important topic to me because I feel it is important that women and their partners as well are given the right to make a decision that works for them. And being that the law is currently trying to stand in the way of that, I am in full support of the Women Protection Act of 2019 and feel that it truly can make an epic difference.